What is CMA? CMA is an intracellular micronutrient assay. That means it's a test that looks at vitamin, mineral, and amino acid levels inside of your cells. You may have heard Dr. Purser talk about, or he always recommends for people to get the CMA with Redox. What does Redox mean? So let's break it down a little bit. The CMA looks at, like I said, vitamins, minerals, and amino acids. Over 50 of these different micronutrients that exist inside of your cells. This can be all range of B vitamins, also a couple of different minerals like copper, taurine, all the different amino acids, tyrosine, cysteine, even glutathione and sod. The Redox is different because it's an antioxidant panel. Different than just the vitamins, minerals, and amino acids, it's a full spectrum panel of antioxidants. Now, there may be several different antioxidants that you may be curious to know if your cells are deficient in them or not, such as glutathione, SOD, NAC, and CoQ10, PQQ, and many others. Together with the CMA results and with the antioxidant profile, the Redox, we can test over 100 different substances to see what your cells are deficient in. Now, the cool thing with the CMA part of the test, the way that they run this test is maybe kind of backwards to what you think. We take a blood sample and then we isolate the leukocytes or the white blood cells within that sample. Then we're able to feed those cells all of these different nutrients, and based on the uptake of these nutrients into those cells, we can tell how deficient those cells are in those substances, such as glutathione. I'll always talk about glutathione. If we give that cell a lot of glutathione and it takes in a ton of it, then it knows, now we know that cell is craving glutathione. And so white blood cells, especially leukocytes, need a lot of glutathione because it's one of the main substances that help protect your body and support immunities within your body. Sometimes our patients get a little confused with the results of the panel of the CMA versus the Redox, because the CMA may show, such as glutathione, it could be totally normal in the ranges on the CMA side, but then on the antioxidant Redox panel, it may show that glutathione is highly protective. Now, what does that mean? You may have sufficient levels within your cells according to the test, but the Redox panel looks at how much those cells react to those antioxidants. When we introduce those antioxidants into those cells, and then we can see that antioxidant, such as glutathione, is super protective and getting right to work as soon as that you introduce it to it, then we know that cell is lacking glutathione. Even though it may have sufficient levels according to the test, it still wants more. It needs the protection that it can provide. So that's why it's really important to look at both the CMA and the Redox panel and compare them together and use them together. If it's showing highly protective on the Redox panel, that means that those cells need it. You need to supplement with it. You need to increase things in your diet to help provide what your body needs to make those antioxidants. So make sure that you are looking at that antioxidant Redox panel. If we can see that you are deficient in certain antioxidants or that your cells need them, we're definitely going to give it to you. Now, just as a general reminder about CMA, why do we even do this test? We look at these levels inside of your cells because that shows the root of what we're dealing with. Genetic deficiencies, different SNPs, cause your cells to have certain vitamin deficiencies. And so when your cells are deficient in these, that means everything is working much less efficiently than it should be. And that's where supplementation with the right versions of vitamins, minerals, amino acids, and antioxidants, the right versions that your body and your genes need to function correctly, everything changes. Symptoms disappear. Methylation is supported. Transsulfuration cycle happens. Inflammation is one of the main things that we deal with, disappears. So that's why you need to get a CMA with Redox so we can get a full picture of what we're trying to help you with.